veterans and military family members are not immune from the threat as targets or as perpetrators. This concerns everyone, the veteran community, all Americans, and the world. As veterans and military family members, it is important to build our awareness and to monitor criminal extremism. As a strong, civic-minded community with a long history of protecting this country and its citizens, we can and should do our part to help prevent criminal extremism, especially among our own. One way to become part of the solution is to understand both risk and protective factors to radicalization to extremism, the circumstances that impact each, and actively work to build a support network for those within our community who may be at risk. Protective factors are those pro-social characteristics that, when present, make it less likely that a person will engage in both violent and non-violent criminal extremism. These can include being married, having a stable job, having children, and acquiring an education. These factors strengthen an individual's bonds to society and occupy time that they could otherwise spend engaging in delinquent activity. They also reflect a person's established social status, which forms the basis of healthy social identities and ideas of self-worth. In contrast, the absence of these factors, especially when combined with destabilizing elements such as drug or alcohol abuse, mental health concerns, traumatic experiences, and criminal histories, are often considered risk factors for extremist radicalization. What can research tell us about risk and protective factors that are common among criminal extremists with military backgrounds? The 659 subjects in Pyrrhus with U.S. military experience are overwhelmingly men, with only 16 female subjects represented in the data, 7 of whom participated in the Capitol breach. The low percentage of female subjects in Pyrrhus with military backgrounds stands in contrast to the rate of women in the general adult population who have served in the United States military. While women make up only 2.4% of the subjects in Pyrrhus with military backgrounds, they represent 9% of the adult population in the United States with military experience. In addition to gender, other risk factors include age, marital status, and parental status. According to the data, criminal extremists with U.S. military backgrounds have a median age of 37 years at the time of their offenses or arrests. They are more likely to be either married or divorced individuals and are more likely to have children than criminal extremists without a military background. Those with higher rates of unemployment or substance use are also at greater risk. In fact, the rate of unemployment in Pyrrhus for those with U.S. military experience is even higher than criminal extremists in general, at 25.3% compared to approximately 20%. Individuals who are no longer in the armed forces when they radicalize are more likely to face challenges associated with poor social mobility, past criminal convictions, and certain types of antisocial relationships, such as extremist family members. Some individuals are also vulnerable to radicalization because of their previous military experiences and related mental health concerns. By comparison, individuals who radicalize before or while serving in the U.S. Armed Forces appear to be less likely to have age-related risk factors and social mobility challenges, but they are more likely to radicalize alongside other members of the military. Keeping these risk factors in mind, it is important to remember that not every person will radicalize in the same way. More importantly, most people who display these risk factors are not extremists, nor will they become extremists. Rather, the presence of these risk factors may create a potential opening for extremist narratives that try to capitalize on a person's vulnerabilities. When determining the best way to help a person at risk, the presence of risk factors should be considered in the context of that person's life and paired with other observations. Differing radicalization pathways and life experiences also means that education and prevention programming, as well as interventions to help those who may be radicalizing, will need to be tailored to specific configurations of risks and vulnerabilities. Interventions that help those at risk to develop healthy social identities and ideas of self-worth, while strengthening their bond to society, will need to be tailored to each individual. As a member of the veteran and military family member community, building and maintaining awareness of risk and protective factors to radicalization to violence is an important step toward keeping our communities safe. We can be part of the solution by building motivation within the military and veteran community to protect each other and the community at large against extremism, by using our relationships and connections to find each other, support each other, and lift each other up. We can stay attuned to the issue and help identify and connect those at risk to military and veteran service organizations.